Hi, I'm Sam from Respiratory. We're going to talk about putting a patient on a T1 ventilator in the emergency department. Go ahead and push this power button. Like all respiratory devices, it takes 30 seconds to kind of do a self-calibration and load up. While you're doing that, you're going to want to make sure this thing's plugged into oxygen and power. And plug the oxygen into the wall as well. The end of it's going to look like this. What you're going to want to do is get a filter, which is a separate item in the supply room, stick it onto the end here. Next, what you want to do is a separate part. This is the end tidal capnography. You'll stick that here in line, and then the last piece is the ballard or the inline suction. So that's how you suction somebody. Plus it gives you this accordion so you have more flexibility, less likely to extubate the patient. And that piece goes right on here with the corrugated tubing. So as far as hooking up the ballard to suction, make sure you're on a suction canister on the wall. Literally just stick it right here. If you want to clear that airway, what you'll do is take your hand and kind of slide this. And you kind of have to work your hand up and down. It goes down. Once you get to the cariner where you need to go, push this and depress it, and then pull it on the way out. As you come out, hopefully you're clearing out that airway. And that's how you hook up suction. If you want to hook up end tidal, this will go to your Philips monitor. So there'll be a little screw cap that goes right below your monitor that has your SpO2. It'll say ETCO2. So it's just a screw cap here. It sometimes has a trap door, so you got to use your finger to open the door, and then you screw this on. Now that the machine's kind of done its self check, this mode is the basic mode that it generally starts with. Sometimes it'll be a different mode, but this is just your APV CMV, so it uses pressure to get a target volume. These are the settings right here. What I generally say is 500 for an adult male, 400 for an adult female. That'll get you started. Go ahead and put in the sex and the height. That'll tell you how many mils per kilogram you're getting in the patient. If you want to control the rate, you need to go into controls and hit the button. And all these are kind of touch screen. Turn the knob to 15, 16, whatever you think you need to be, and then hit the button again. Now just attach it to the patient. We'll come over here and do that so you can see it. Once the patient's been intubated and the airway is secured, this one's not secured, but we'll say it is. Just place this right on here, then come back over to the ventilator and hit start ventilation. As far as PEEP goes, it usually defaults to 5. That's probably fine, but if you have a higher FiO2, you're going to want to increase the PEEP, or if they have a large body habitus, you know, if a BMI of 30 or 40, you're going to want to hit that 10, 12, 15 mark. But 10's probably pretty good for just about anybody. And then FiO2, obviously you base that off the SpO2 on the monitor. If they're desaturating, you can go all the way to 100. Another option is this button over here, the increase O2. That gives them 100% for 2 minutes. Alright, so if you want to make sure you have a lung protective strategy, you want to check out your driving pressure, and you need to do that by getting your plateau pressure. So if you want to zoom in over here, you can see that there's this little lung button. If you push and hold that button, you can get that inspiratory pause to give you your plateau. So if you look over here on the monitor, you're going to see the breaths go in, the breaths go out. On this next breath, I'm going to pause it by pushing the lung button. So now it's holding, it's holding, it's holding, it's holding. I let go, and I come up here and I hit the pause button, which is these 2 triangles with a line. That pauses it. Now I need to use the scroll button to scroll over here. You're looking at that PAW, or airway pressure number. Once I get this white line up to the plateau, you'll see what the plateau is. So now that number is 29. The driving pressure is the difference between the plateau and the PEEP. 29 minus 10 is 19. That's greater than the 15 that you want to be at max. 15 or less is what you want for driving pressure. Otherwise you cause barotrauma or volutrauma. And it's not conducive with life long term. So how do I fix that? Well, the only way to really fix that in this mode is to lower the tidal volume. So I'm going to unfreeze this, click on this, and let's go down to, let's say, 300. Now we're on a mannequin, so it may or may not actually lower, but this is what you would try to do. I'm going to go again and do that plateau pressure, and let go. And then up here I want to pause it again, and scroll over to the white line hits your plateau pressure. And now that's 25. So now we're at 25 minus 10 is 15, and now you're at the safe level of ventilation.